So, what are the three most important things for you to focus on early on in your recovery from having had a knee replacement? Let's talk about it. So, number one, most important thing, really, bar none, and it really is something that people don't discuss very much. It's kind of taken for granted. But I actually had a patient just the other day who had this as a problem, and that's going to be protection. Your number one most important thing is you need to protect that knee. Um, it's probably very much in the forefront of your mind after having had that knee replacement, but protection is really, really critical. So you don't want to have any sort of a fall. That's what actually I had a patient that came in to see us the other day. Was actually going into her door from outside and tripped over the threshold and wound up falling. Thankfully, she did not fall on her surgical knee, but still, it's created lots of inflammation and things, and so it still was impacted. So you want to be making sure that you're paying very close attention to your footing. You should be using your assistive device at all times. At early on in your rehab, you're going to be using primarily a walker for the first really 2 to 3 weeks. There's another video where we've talked about that, and some people don't always go to that far, but in general, that's what you're thinking about. But using your walker, using your cane, anytime you're not taking good steps and you have some difficulty in bending your knee, that's you certainly want to focus on that. So making sure you don't have a fall. Another thing about protection is going to be just not overworking the knee. So sometimes you have these people who are these real hard chargers, and they're really gung ho about going really hard at their rehab. And I always try to impress upon those people, like, look, later on in the rehab and your recovery, more in that 6 to 8 to 12 week phase, that gung ho attitude will serve you very, very well, and that will be your friend. But early on, which is what we're talking about here, those first few weeks, that is not your friend. You are really close to overworking your knee. Overworking then necessitates more inflammation. More inflammation is going to lead to more swelling. More swelling is going to lead to more pain, and you've got this cyclical thing going on. And really, with that more swelling, you're going to get to range of motion issues. So you're wanting to protect the knee, making sure you don't have any falls, making sure you're using assistive devices appropriately, and making sure that you don't overwork things. Don't overdo it. Don't be on it too much. Give yourself rest. Rest is a very critical component after you've had these sort of knee surgeries. Okay. All right. So now on to number two. So the second most important thing, and these numbers aren't necessarily in orders of priority, but well, yeah, they sort of are. Now that I think about it, probably the second most important thing is going to be focusing on your knee range of motion, especially extension. Extension, extension, extension. It is critical that you achieve 0 degrees range of motion on your knee. You want to get your knee back to being as straight as you can make it. Um, a lot of times when patients, I asked them, hey, how's your range of motion going, or how's your kneehab going? What's your range of motion like? And they'll be like, oh, it's great. I can bend it really well. But then I'll ask, well, what about your extension? Where are you there? And they'll just look at me with like kind of a blank stare, not even thinking about it. So we try to always impress upon folks, look, you're achieving extension, getting your knee to be perfectly straight is the most important range of motion measurement that you're trying to achieve. It's not to say that flexion isn't important. It is, but it is not as important as achieving extension. The reason for that is your life is flexion. we're constantly going up and down stairs. We're getting up and out of chairs. We're getting into and out of cars. Like life is flexion based. You're constantly required to bend your knee just to go through life. So there's a certain amount of flexion of the knee, of bending of the knee, that is just going to come back naturally. It's not to say that all of it will. So don't hear me saying that because that's not what I'm saying, but a significant amount of that can come back with just living life. Okay. However, extension, achieving that full 0 degrees of extension, getting your femur, your thigh bone, and your shin bone, your tibia to line up directly, one on top of the other, that you can live your life without achieving full extension. Okay, you can walk around and not make that measure and be okay. However, your knee that has just been replaced, if you do not achieve that full extension, you're likely going to start having some pain start to come back into that knee in, a year, maybe 2 years, because things are not wearing correctly, because of lacking that full extension. You then the bones are not gonna they're not lining up well, things aren't moving exactly as they should, and you are looking at a likely redo of this knee surgery. So extension is the most important range of motion measurement you can achieve. um, Flexion is important. Flexion is number two. Okay. So or let me say, instead of two, we'll say B. So of this category of achieving knee, you're focused on your knee range of motion. Extension is two, and 2A. Flexion is sort of a distant 2B. It's important. It should be certainly something that you're thinking about, but it's not the end all be all. Extension is, as far as the range of motion measurement goes. So I definitely want you to achieve 0. Your goal, that's within the first 2 to 3 weeks. Your goal for flexion within the first 2 to 3 weeks, it's going to vary sort of by the surgeon. We generally are trying to get you above 100 degrees within that first time frame, and then progressing over time in outpatient with us, to get back to the full range of motion, and that following somewhere in the 8 to 12 weeks or so. Um, the full That's going to vary per person. There's going to be a difference in age. There's going to be a difference in functional level. So we generally say, okay, look at your good knee, your knee that has not been operated on. What range of motion does that knee have? Now, that's assuming that knee is a good knee. Sometimes it isn't always, but your knee replacement knee, we're looking to now get to the range of motion that your other knee is able to achieve. So that for us is what we're trying to get to as far as flexion goes. Um, and really within these, it's kind of implied within with what we're talking about, that this is going to all be achieved by you actually performing your home exercises that your physical therapist has given to you. So that's another critical component of this. It's still, and I'm gonna say this is still all in the same category though of this number two. It's still, to be able to achieve those range of motion measurements of extension and flexion, you're going to have to be doing your home exercise program. So this, in this category, this may be a 2C, is focusing on those that home exercise program, and you're going to need to be walking a bunch. Short bouts, generally it's the knee is probably going to get stiff if you're sitting for more than like 30 minutes to an hour. So you're going to need to be doing short bouts, short frequent bouts kind of throughout the day of just walking around on it with your walker, making sure again that you're protecting. Always number one is always protection. Number two is working on that knee range of motion with primary focus on extension, with a follow up focus on flexion after that, and doing the exercises to get to that. All right. So that's going to bring us to number 3. So the third most important thing for you to successfully get through this early phase, this acute phase of your knee replacement rehab, it's going to be icing and resting, but especially icing. you're going to want to ice your knee minimum about 3 to 4 times a day. You're going to want to use that for about 20 to 25 minutes. I generally recommend the cold pack ice packs that you can get. I actually did the previous video I did, which I'll link at the end of this. It shows where you can purchase those from. If the hospital hasn't given you any cold packs or not any ice packs or gel packs, whatever, to come home with. But those cold packs are really, really good. But you're going to want to ice about 20 to 25 minutes. What icing is helping with is a few different things. It is helping you to calm so let me step back. So after you've had the surgery, your knee is going to be swollen. It's swollen because you just had, there's been lots of invasiveness and invasive actions have happened within that knee joint. So now your body is trying to heal from that. Within that healing, you're going to get increased blood flow. That increased blood flow is going to then lead to inflammatory byproducts that are kind of the part of the healing phase. And that's going to lead to swelling. As swelling is there, that's going to lead to pain. And so then that's going to all factor back to what we were talking about at number 2, which is your range of motion. So to help keep that swelling under control, we want to keep that inflammation under control, and to help with that pain, ice is the solution. So you're going to want to use 20, 25 minutes on, generally about 30 or so minutes off, let it get back to regular temperature, and do that at minimum of about 3 to 4 times a day. You can do it more than that if you need be within those first few weeks. Now you are going to want to wean yourself off of that somewhere around that time frame, but that should naturally really happen. I don't really run into people with too much of a problem with that. But it's all about trying to keep that swelling under control and that inflammation under control. So ice helps to push away blood flow. That coldness is going to shrink up the arterioles. That's going to help to push that blood flow away from the area to then calm everything down. That's what, in these early phases of such a big invasive procedure to the body, you're wanting to just calm everything down, keep inflammation to as minimum as you can, and then that's where you then are able to then move a little better and work on that range of motion. As range of motion improves and motion happens, then that also helps to feed back to then help swelling kind of reduce. So it all kind of works together. All three of these things of making sure that you're staying protected, making sure you're working on that knee range of motion and doing the exercises that you need to be doing to get that range of motion back, and then using ice to then control how all of that is affecting the knee, and just keeping that inflammation under control. The worst thing, the absolute worst thing that you could do after having had a knee replacement in this early phase would be to sit down in a chair, find a comfortable position for your knee, and then don't move it for several hours. Absolute, bar none, worst thing you could possibly do. You want to have an unsuccessful rehab of your knee replacement, you do that for several days to several weeks, and you will, I'm telling you, you're asking for some trouble. So focus on these 3 things that we're going over, and you should have, you should be at least getting off on a very positive step to having a very successful recovery. So I hope that this has been beneficial for you. If you have any questions about that, please let me know. And otherwise, we'll catch you next time. Thank you. Bye.